Hi, my name is Sairel Labasan, and I am a Master's of Public Health graduate from the University of Hawaii at Manoa. And today I'll be talking about my project with the Chuuk Community Health Center. So the main goal of my project was to describe the methodology and the results of the household survey that was implemented by Chuuk Community Health Center and to examine the potential implications of the survey. My main activities were to conduct data entry, data cleaning, as well as to provide descriptive statistics and to create graphs and tables and reports for Chuuk Community Health Center to use. But before I get started on my project, I'd first like to go over a brief overview of the Federated States of Micronesia. So FSM is a country made up of 607 islands that's scattered throughout the Western Pacific. It's made up of 4 states, Chuuk, Pohnpei, Kushai, and Yap. And in 2012, the population was at 107,500 people. So health in FSM can best be described with the term triple burden of disease, which describes high rates of communicable and non-communicable diseases in addition to the impacts of climate change. So FSM has a high premature mortality that can be due to, that's primarily due to NCDs and can be attributed to the reliance on imported packaged food, lack of physical activity, as well as the use of tobacco products. And so in Chuuk State, Chuuk is the most populous state of the 4. Roughly 50% of the total population of FSM reside in Chuuk, and they have the highest percentage of expenditures that's supported by US grants, but have the lowest GNI per capita and the lowest GDP per capita. There also exists an imbalance of compact funding distribution, which leads to low levels of public service, as well as Chuuk lagging behind the other states on some key indicators. And so I did my project at the Chuuk Community Health Center, which is a federally qualified health center that was established in 2017. They provide primary healthcare services in addition to dental services, transportation to and from the state hospital, and pharmaceuticals. Right now, there are 3 health centers that's all located on the island of Weno, one in Nepukos, which serves as a central location, one in Neo, and one in Sapuk. So the aim of the household survey was to better understand the health of the communities and to inform CCHC's priority setting. It was conducted from March 3 to August 17, 2018, and February 18 to May 17. The sample population was made up of the 13 villages within Chuuk CHC's catchment area. And essentially, the survey was a needs assessment that looked at demographics, health behaviors, environmental living conditions, and of course, non-communicable diseases. So the questions that were included in the household were guided by existing knowledge. The field survey was conducted by the 6 community health workers, and they did this from 9 a.m. to 5 p.m., and they did the interviews in pairs. In regards to data collection, they were trained to ask for the head of household as well as to follow the general flow of the survey, which was conducted in English. Data entry was on Microsoft Excel from February 2019 to May 2019, and then cleaning and analysis was also done on Microsoft Excel. And here we just have the results of the demographic information for the head of households. So after the survey period, a total of 1,192 households were surveyed. And in general, our head of households were between the ages of 40 to 59 years old. They were mostly female, married, of Protestant religion. 37% had completed a high school diploma. 70% were unemployed. Almost 70% were non-smokers, and 75% did not have health insurance. And here are just some of the results from the household survey that I would like to highlight. So as I mentioned, the population of Chuuk is very young. 57% of the households reported having someone who was between 0 to 5 years old, and 79% of the households reported having a member who was 6 to 21 years old. In regards to health behaviors, over 60% said they had someone who smoked cigarettes, over 70% had someone who chewed betel nut, and over 50% had a member who had consumed alcohol. And for environmental conditions, I'd just like to highlight that over 50% of the households were still using catchment methods to get their drinking water, and over 40% were still boiling their water to prepare it for drinking. And also 30% were still burning their trash. Hypertension was the most common health condition at 46%, followed by diabetes and then asthma. And so here I just have some implications for Chuuk Community Health Center. As I mentioned, the population is very young, which just points to the fact that Chuuk CHC should focus on providing more pediatric services, for instance, dental services, immunization, and screenings. In regards to the health behaviors, they should be ramping up education efforts, especially since there seems to be an exposure of young children in the households. Secondly, many households were still burning their trash, depending on catchment water boiling and using overland and oversea methods. And so this may be the reason why there is still a high prevalence of asthma in children and GI conditions in some villages. And so definitely to increase education efforts on the effects of these activities on their health. And third, many households reported having the most common diseases in FSM, and so a continued effort to address these NCDs and to focus on increasing the expansion of medication coverage in the villages. So for my recommendations, I focused more on a larger public health level. And so I've identified that investment in community health workers by providing them with more education, more training, and expanding their duties into the community would be very beneficial. And for HRSA and other funding bodies to continue to support Chuuk CHC in ongoing systematic collection and analysis of data, as well as to prioritize the dissemination and publication of this data while keeping in mind Chuuk's capacity to do so, which may mean to publish data that might be unreliable or not as robust as sought for. And finally, just to general increase funding for locally led population-based surveys in the whole state of Chuuk by providing education and training to the existing local health workforce. And I kind of synthesize that into a top three public health implications on a larger level. One is to develop Chuuk's human resources. Two, to focus on improving Chuuk's overall infrastructure. And third, for the FSM government, local stakeholders, and international funding agencies to prioritize data and to see data as the foundation for policy development, program planning, and the prioritization of resources and funds. And finally, overall, the outcome of Chuuk CHC's household survey was very positive. It provided Chuuk CHC with baseline data that was on a household level, and it also aimed to capture their entire catchment area. But most importantly, it provided experience to the community health workers and to the other Chuuk Community Health Center staff. So thank you to everyone who supported this project, and of course to the Western Region Public Health Training Center. Thank you very much.